Welcome to the Egg Whisperer Show. I'm Dr. Amy, and I'm here to help you stay informed so you can stay empowered on your fertility journey. Today, we look at ambition, timing, metabolic health, emotional resilience, modern family building, and what it means to truly plan your reproductive future. Today's episode is titled Own Your Fertility: Why Planning Early is the New Standard of Care. Our guest is my friend and colleague, Dr. Jaime Knopman, reproductive endocrinologist and author of Own Your Fertility, which was just released. She brings clarity, honesty, and courage to conversations our patients need now more than ever. I'm delighted to have her on so we can talk fertility doctor to fertility doctor about all of the behind the scenes of setting yourself up for the best possible journey. If you're the kind of person who loves a good plan and wish that there was a straightforward plan to reference for your fertility journey, you're going to want to tune in for this conversation with Dr. Jaime Knopman. Jaime, thank you so much for joining me today.
Thank you so much for having me. I appreciate it.
So you talk openly about when this all started for you, specifically that you were inspired very early by Elizabeth Blackwell, who was the first woman to get a medical degree in the United States. I
Mhm.
love this because I also knew from very early on that I wanted to go into fertility medicine. Can you tell us what about Dr. Blackwell drew you in, and how did it inspire you to become an REI doc?
Yeah, I think I just thought I wouldn't have said these words back then, but I think I thought she was so empowering, right? She sort of was like a badass. She knew what she wanted to do and she just did it. And it didn't matter that she was a woman and the standard of care was that physicians were male. And I really like science. I know it sounds nerdy, but I did. And therefore, I went to college with a very linear path, knowing I wanted to go to medical school. Initially, I knew I wanted to do something in women's healthcare, but I thought I wanted to be a surgical oncologist, perform mastectomies, lumpectomies, etc. And then once I got to medical school, I realized I actually wanted to do OBGYN.
Yeah, what a great story. So let's talk about the first time you meet a patient, because I think this helps patients know what to expect and can give other doctors good ideas too. Obviously, we have to start with the basics, but you say, when I meet a new patient or couple, I go from nice to meet you to some version of what fears keep you up at night within the span of an hour. What does this look like, and why is this important to you?
Yeah. I always say, I don't want to be too intrusive. I'm not here to get your gossip, but I need to know what you want your future to look like. Ideally, if I'm really going to help you, right? Do you think you want 4 kids, but you don't want to start till 40? Or do you want one child and you're going to start next year? Because then I can guide you with what is the correct decision for your fertility. And I need to know, do you have a partner? Are you thinking of doing this on your own? Is this partner the one you think you'll have children with? So there are a lot of seemingly invasive questions, but what we use to really guide a patient to the right path.
I'm super nosy. I don't just have a big nose, but I'm also very, very nosy. And you're
Yeah.
right. We get people to tell us things that sometimes they haven't even told their partners.
Yep.
Yeah.
Correct. Mhm.
So explain the cleverly named other plan B. What are some of the top things people need to know about preserving their fertility that seems to surprise them?
I think, and we were just chatting about this before. I think women are often surprised at how impactful their age is going to be on their fertility. And I think that's because for most of us, we sort of assume our fertility is a given. So we don't think about it until sometimes it's too late. So I mean, you and I have seen a lot of women come into our offices in their mid 40s saying, "Oh, I think I'm going to start to try to have a baby." And we are like, wait a second, where have you been for the past 10, 20 years? And it's not to be insensitive, but it's wow, people really don't know what's going on in their bodies.
People think that we're being mean to them when we say things like you're in perimenopause right now, but that's just
Yep.
normal human biology. There was a study that just came out showing that it's actually the age 32 that we see
Yep.
a bigger decline. You probably saw that as well. And I think so many women think it's 40 or 50.
Correct. People
Yeah.
think, and I remember I came up with this slogan in med school for a abstract we submitted for ASRM. Menses does not equal motherhood, right? Just because you're getting your period, it doesn't mean the quality and quantity of your eggs is able to make a healthy pregnancy. So I think we're often misled by this concept. And it doesn't mean we want to scare women or make people think that they're all going to be infertile when they hit 32, but it does mean that we have to think about that in order to plan for our future.
Yeah. And there's nothing wrong with being hopeful at the same time. If, let's say, you are, for example, 45, you and I both want all of our patients to succeed the way they want to. We don't want them to have to use an egg donor, but sometimes we have to have those hard conversations with patients. So
Correct.
you described the puzzle as your go-to metaphor to explain infertility. What are the 5 pieces of the infertility puzzle? And I really like that analogy. What are the basics that
Yeah.
patients need to know about each of the puzzle pieces?
Well, I see 2 pieces come from your ovaries, right? Because you need to ovulate or release an egg, and the quality and quantity of your eggs has to be adequate. Your fallopian tubes, your uterus, and then sperm. And I say there's probably multiple more pieces that we will discover as fertility as a field of medicine grows, right? Because you and I have both sat with many a couple who have what we call unexplained infertility, where all the pieces of the puzzle seem to be checking out, but they're not getting pregnant. So there's probably a lot of other pieces. We're just unaware of what those pieces are today.
You learn so much as, let's say, you put someone through an IVF cycle and you learn about their egg quality in ways that an FSH and AMH level just don't tell you. So
Correct.
you have this analogy that I also really, it's called the fertility treatment ladder. I mean, that's a brilliant way to explain how many doctors and patients approach the fertility treatment plan, often from an organic standpoint. If one treatment doesn't result in a pregnancy, then another option may present itself. How do you phrase this with patients to help them understand the different types of treatment from the start?
Yeah, I explained to them it's sort of, like at the base of the ladder or the lowest rung is just unprotected intercourse. If you're having the heterosexual sex, right, and your partner has sperm. As it doesn't work, we need to sort of go up step by step to become more aggressive in our treatment modalities. Now, you and I both know just because you get to the top, which a lot of people consider to be IVF, it doesn't mean that you can't do it again, right? I think there's a fear sometimes if I do IVF and it doesn't work, then there's nothing else you have to offer me. Well, there's a lot of things we have. We can do it again with a different protocol. We can change some other things in the lab. But I think it's easier to think about things in a stepwise fashion than a huge leap to the end, because that could be overwhelming.
Yeah, a lot of what we do can seem overwhelming, especially with lots of the things that patients read in Facebook groups or on Reddit where people have gone through IVF that doesn't work and it just makes them feel like they just don't want to have those experiences. That's a good point. One of my favorite things about, doing these shows and being on social media is fertility myth busting. And you do
Yeah.
a lot of that in your book in chapter 7. And I know that helping
Yes.
people understand the differences between fact and fiction helps them plan for a much smoother journey. Let's do some fertility myth busting with some of these misconceptions that I haven't tackled on the show before. You're able to get pregnant until you hit menopause, which is when your fertility comes to an end.
Yeah, I mean, that's sort of like the menses doesn't equal motherhood, slogan. So we will get our periods. I'm an open book. So I'm 47 and a half. I still get my period, but I certainly don't have good eggs, right? So I'm not getting pregnant. So it doesn't mean that if you are still menstruating, the quality of the gamete is able to develop into a healthy pregnancy.
Right. A period is your egg coming out. If you look closely enough, sometimes you can even see a tiny egg in the blood, right? That's why you're most fertile during menstruation.
I have heard this so many times, and I thought the first time I'm like, "Oh, it just must be a one-off." And then when patients said it to me repeatedly, I was like, "Okay, this is no, incorrect." So I was like, "Your period marks the beginning of the next cycle. There's no egg." I was like, "What you're seeing come out is just tissue from the uterine cavity. You're most fertile usually 2 weeks after that." So I was struck by the unawareness, I guess I would say, of of a lot of people.
Yeah. And then also like the egg white cervical mucus, people think that's like a cracked egg, like a chicken egg.
Yeah.
Like
Yep.
that's I mean, in a way, it is a sign the egg is coming out in a few days, but it's not anything related to your egg, meaning
The
it's not
actual egg, yeah.
the actual follicle with cervical mucus coming out. Okay. You have a 50-50 chance of getting pregnant every month.
Yeah, I mean, you and I see this a lot, right? Patients will say, "I don't understand. I started to try. I had sex on the right day. I am not pregnant." And I'm like, "Of course you're not." Like most of the time, We know you're only your most fertile in those first few months of trying. Your fecundability is 25% max. So most of the time, you're not going to get pregnant. And I think people are so surprised by that statistic.
Yeah. Humans, we're not very good at getting pregnant. We're
No,
just
we are
not as
very
efficient as other
inefficient.
animals.
Reproduction is inefficient. Yeah.
I wish we were like bunnies. I wish we can ejaculate like men every day and have eggs come out. The wait for it and wait for it. It's like you have to wait 2 weeks of ovulate, wait another 2 weeks, find out if it happened. If we could figure out a way to ovulate every day, don't you think that'd be pretty amazing?
Yeah, because then you'd up the odds significantly.
I know. Maybe an invention for me. Okay. So, next myth, out of balance hormones are why you're having a hard time getting pregnant.
I mean, the hormone topic has become really, mainstream. People come in. I see a lot of women who are like, I want to balance my hormones. And what I say is, no, hormones are never balanced. That's what happens in the menstrual cycle, right? There's a natural fluctuation and cadence. You're going to see a rise of estrogen, a rise of progesterone, but that is normal. Are there situations where you're not having this regular fluctuation and that's abnormal? Sure, PCOS or hypothalamic amenorrhea. But balancing your hormones is not going to make you more fertile per se.
Yeah, I mean, when I see a patient who has a high FSH, she wants me to help her lower it. FSH being high isn't something that we necessarily treat. It's just something that we use to help understand what's going on with you. There are certain things that might help, like supplements and a couple other things that may help lower the FSH. But overall, you're right. Balancing hormones is something that I totally agree with. It's very much trending on social media.
It's very in vogue now. Everyone's like, I want to balance my hormones.
Balance my hormones. Yeah. Okay, next myth. Your infertility is in your own hands or somehow because of something that you did.
Yeah. I mean, again, we see this all the time, right? I want to control it. It's my fault. I ran across the street after my embryo transfer and that's why it didn't work. Or I ate pasta for dinner and that's why my egg quality is bad. I always say, I wish it was that simple, right? But unfortunately, most of the time it's not. And you trying to control it, what I think happens to women is they become a tight grip on trying to control. And it makes the process even more untenable because they can't pull through because they're just trying so hard to grip it and to control it.
Yeah, I mean, the take control of your own fertility. I mean, you can take control of the knowledge that you gain about your fertility, but it's just one of those things. It doesn't matter how hard you work. There's little that we have control over except the doctors we see, how we take care of ourselves, how much sleep that we have at night. So next myth, there is a test that measures how fertile you are. Just ask your doctor for the fertility test.
I mean, you probably see this too. All the time people are like, I'm here because I want the fertility test. I'm like, what test is that? Because if you figure it out, let me know. There is no test for one's fertility other than your ability to conceive. So it really started with the influx of egg freezing patients who wanted to know what their eggs were like. And what I say until I'm blue in the face is we know your egg quantity based on your AMH and your antral follicle count, but we don't know the quality of those eggs until they are fertilized by a sperm. So saying I'm here for the fertility test is really an incorrect way to assign validity to that test.
It's not as accurate as we would like it to be. I mean, we can forecast. I mean, I call myself a fertility fortune teller, but fortune tellers are not very good. Yeah.
That's a great way of putting it. Because we're saying we believe your AMH is low. You may have an early menopause or difficulty conceiving, but we don't know for certain.
Let's talk about resilience. The last section of your book is titled, and it's so funny because I always say, just keep swimming too. I just, I have that in my mind and it's like always a tune in my ear. And you tell a story of a patient facing loss. And this is one of the things that we can never really plan for. We don't want to happen to any of our patients. How do you approach this with patients? What do they need to know after a difficult cycle or a loss?
Yeah, I mean, I think, Dr. Amy, these are the hardest conversations that I have, and I'm sure you the same, because we want it so badly for patients. Sometimes I'm like, I think I might want it more than they do, right? And then to have to be the one to break that news, it's difficult. I think I've gotten better as I've gotten older. I think when I was a younger physician, I was so uncomfortable that I would say it really fast and it would sort of like run out of the room. I didn't know what to do. Now I've grown up a bit, and so I'll sit down to make sure I'm on the same level as the patient. If I'm calling, I'll say, "Is this a good time? Do you want me to call you back?" And again, that's just more to allow the patient just like have some control, but also slowly process the information because it's really hard to take in.
Yeah, it really is. And I agree. I feel like as I'm getting older, I'm able to also handle these conversations myself. I used to overeat just to self-soothe because those
Oh, right.
conversations were so hard and just I would be a disaster, a total mess.
No, I agree. And I think one thing I learned was I had a lot of problems separating myself from the patient almost, right? Like I was
Right.
so in it with them that I then was like, wait, what did I do? What can I do? And now I'm oftentimes like, it is nothing we did, right? We have to find a way. I had breast cancer in my late 30s, early 40s. And I often say that was probably one of the most formative experiences for me as a physician because to have the script flipped and I became the patient, it showed me like what was how good as a physician and what was not always great as a physician. Meaning, hey, you have breast cancer. This is all the information. And I'm like, oh my God, like I just can't process this right now. I'm going to need you to call me back in a couple of days because I wasn't ready to get the news, even though that person was ready to call and tell me.
And you share a lot of patient POVs or point of views in your book. Is there one story that stands out to you that you might want to share with us today?
It's so funny because that patient just texted me a few hours ago. She was a woman who decided to go back to medical school in her 30s, right? So she had already been in finance and then thought, this is not what I want to do. So she came in to freeze eggs. She had very low egg quantity. Her AMH was low. She got 1 to 2 eggs per egg freezing cycle. So we had a total of 10 eggs frozen. She goes on, completes med school, residency. She becomes an orthopedics resident and meets a partner and wants to thaw her eggs. She told me this, wasn't aware that orthopedic residents actually have the highest rate of infertility above that of even just women in medicine. She was concerned about carrying herself because it's a very physical residency with a lot of exposure to radiation. She thawed her eggs. We got one healthy embryo, a female, a day 6 euploid embryo. She found a surrogate. Surrogate got pregnant first transfer. I'll never forget. She was on call. So her mom came to the transfer and it was like so beautiful. She just texted me. She actually was not only in the delivery room, the OB let her deliver the baby with
Aw.
her. And they had a 9.5 pound baby girl. I was like, this is so beautiful. I said to her, I'm like, are you willing to share your story before I talk about it? She was like, I want to share it with everyone because had I not frozen my eggs, I don't actually know if I would have ever had a genetic child.
And if she hadn't come to you to get that encouragement to do so, because I think a lot of doctors, it just wouldn't be worth it for them to put someone through that many cycles for 10 eggs.
Because the thing was, I kept saying to her, we don't actually know the quality of your eggs. So if
Right.
you can physically, emotionally, financially keep going, let's try and get to 10. And at the end of the day, like someone might say she has 10 eggs and only one good embryo, but she has a baby now, right? So
Right.
that is a win.
Right. It's a huge win. It's a huge win. So, what do you hope doctors and patients will take from your book?
That's a good question. I think what I hope the most is just awareness about your body, right? Because I think we know, because this is what we do every day in and day out, we know so much about what happens to women and couples' fertility, but so many people don't. And I want to bring awareness to this because as we continue to push when we have children to later and later ages, we need to know this. Otherwise, the rates of infertility will only continue to soar.
Yeah. And the thing is that I feel like there's this pushback on us as fertility doctors by educating patients about this because there's this whole other side where people are saying things like, it's not true, your eggs don't age. And it's just so unfair to people out there who believe that.
Because we see this every day. We know we live it, right? Day in and day out. I also know what will happen if you ignore this and you come to us in your late 30s wanting to have a large family. It is unlikely to happen, and it would have been more likely had you addressed it earlier.
Jamie, where can people find you in your book?
Our book is available now on Amazon and Barnes & Noble. I work at CCRM New York, which is the Colorado Center for Reproductive Medicine. I work at the office that's located in New York City. I also have an Instagram handle at DrJaimeKnopman and a website at DrJaimeKnopman.
Oh, Jamie, thank you. Is there anything else you want to add before we sign off?
I'm so grateful for you having me here. Also, you do amazing work, so thank
Oh,
you.
thank you for saying that. So, Dr. Jamie, thank you for this thoughtful conversation and for the work you're doing to expand access, autonomy, and clarity for anyone planning their reproductive future. All links are in the show notes. Subscribe to the Egg Whisperer Show on YouTube and Spotify and keep moving forward with knowledge, optimism, and your sparkle intact.